Hi guys, my name is LaDonna Cavanis and I am an instructor here at Ultimate Medical Academy. Today we're going to be reviewing medical terms. So let's get started. All right, today we're going to talk about medical terms as they relate to anatomical positions, the cardiovascular system, and the lymphatic system. The classic anatomical position looks at the body standing up from the front. The legs are extended with the feet parallel to each other and the palms of the hands are turned outward. So here's some examples of different types of directional terms. Superior, near the head; inferior, below or toward the feet; anterior is ventral or in front; posterior is dorsal, toward the back; medial is toward the midline of the body; lateral is away from the midline; proximal is closer to the origin or point of attachment; distal is farther away from the body or origin; supine is lying face up; prone is lying horizontal or face down. Body planes. Body planes are imaginary flat slices through areas of the body. They are used to locate structures, lesions, or injuries. The body is always represented in the anatomical position. There are three main body planes, each which cuts right through the midline of the body from different directions. So the three planes are the frontal plane, which separates the body into front and back; the sagittal plane, which separates the body into left and right; and the transverse plane, which separates the body into upper and lower. Here's a list of some word elements related to these body structures. So the root word for antero means anterior or front. Servo means neck. Chondro equals cartilage. Cyto equals cell. And keep in mind, guys, that these are all roots, okay? And here's the meaning. Dorsal equals the back, and guino equals the groin area. Body cavities. Dorsal cavity, it includes the cranial and spinal cavities. Cranial cavity, the brain, the meninges, and all the organs within the skull. Spinal cavity contains the spinal cord, meninges, and the nerves emerging from the spinal cord body cavities. And I provided a link if you guys want to take a look at some of these different anatomical views. Let's talk about the ventricle and thoracic and abdominal pelvic cavities. So the ventricle cavity includes the thoracic, abdominal, and pelvic cavities. The thoracic cavity includes the heart, lungs. It is divided from the abdominal cavity by a muscle called the diaphragm. Okay, abdominal, oh, lost my spot. Abdominal and pelvic cavities, they contain both internal organs for digestive and reproduction, also called visceral, stomach, intestines, and reproductive organs. The abdominal and pelvic cavities form the abdominal pelvic cavity. Guys, see that? The abdominal and the pelvic cavities form the abdominal pelvic cavity. Let's talk a little bit about the abdominal pelvic cavity. It is divided into 9 regions: right and left, hypochondric regions. Hypo means under, okay? And chondro means cartilage. These are the spaces located just under the cartilage of the rib. Epigastric, epi means over, gastro means stomach. This is the region just above the stomach. Umbilical region. Umbilicus means belly button. This is the central region that contains the belly button. Hypogastric, the region below the belly button. So let's talk a little bit about the right and left lumbar region, which is located at the waist below the hypochondriac regions. Right and left inguinal regions flank the hypogastric region. Inguinal again means growing. This is also referred to as the growing area. Okay, let's talk a little bit about the spine. Your spine is made up of 24 small bones, vertebrae, that are stacked on top of each other to create a spinal column. Between each vertebrae is a soft gel-like cushion called a disc that helps absorb pressure and keeps the bones from rubbing against each other. The region of the spine consists of cervical, thoracic, lumbar, and sacral. The cervical spine, the neck region, is also known as the cervical spine. Then you have the thoracic, the lumbar, and the sacral areas. All right, let's break it all down. Let's talk a little bit about medical terminology pertaining to we'll start out with the cardiovascular system and we'll end talking about the lymphatic system. So the heart is divided into 4 chambers or compartments. Upper part, you have the 2 atriums, the plural, the atrium, and the singular. The lower part, you have the 2 ventricles. The heart has 2 sides, the left and the right. Each side has an atrium and a ventricle. The heart structure, right side, pulmonary circuit. The right atrium receives blood from the body parts. Right atrium receives blood from the right atrium and pumps it into the lungs. The left side, systemic circuit, receives blood from the left ventricle, receives blood from the left ventricle and pumps it to the rest of the body. The structure of the heart vessels. So you have the tricuspid valve, which is between the right atrium and the ventricle, and then you have the bicuspid or mitral between the left atrium and the ventricle. Structure of the heart. Electric system of the heart consists of 3 nodules or bundles connected by Purkinje fibers. Sonoatrial nodes, the pacemaker of the heart, atrioventricular node, transmits signals to form atrial and the ventricles. Atrioventricular bundles are the bundles of His, H-I-S, transmit signals throughout the ventricles. So when we talk about blood vessels, we're talking about arteries and veins and capillaries. So arteries take blood away from the heart, veins bring blood back to the heart, and capillaries connect the atrial and venous systems. Okay. Word elements. So when we refer to angio, we're talking about the blood vessels. When we refer to aorto, we're talking about the aorta. The arterio, it's artery. Athero is fatty plaque. Atrio, atrium. And brady means slow. And cardio represents the heart or equals the heart. Corono equals coronary or crown. Ectasis equals dilatation. Emia equals blood. Homoe equals blood. Myo equals muscle. Peri is around. And phlebo is vein or equals vein. Stenosis is narrowing. Valvo is valve. Vastrio is dilated. Vaso is blood vessel. Veno equals vein. Ventricule is ventricle or equals ventricle. All right. The circulatory system transmits oxygen, nutrients, waste through the body and the blood. The liquid part of the blood is called plasma, mostly water, contains dissolved nutrients and waste products, CO2. The solid part of the blood includes red blood cells, white blood cells, and white blood cells. The solid part of the blood includes blood, also contains platelets, tiny pieces of blood cells inside of membranes. Platelets cause blood cells to clot when a vessel is cut. So this is where the clotting factor kicks in. All right, so let's talk about the red blood cells and the white blood cells. Red blood cells absorb oxygen from air into the lungs and transport it into every cell in the body. They also transport carbon dioxide from the cell of the lungs to be exhaled. White blood cells help the body fight infection. They attack and destroy viruses and bacteria that enter the body. Here's some common procedures on the heart. So echocardiogram. Okay, an echocardiogram or a graphy is an ultrasound of the heart. It uses standard 2-dimensional, 3-dimensional, and Doppler ultrasound to create images of the heart. Angioplasty. It's a procedure that opens blocked arteries, and my mom, she recently had to have this procedure. So it opens blocked arteries and restores normal blood flow through your heart muscle. It is not a major surgery. It is done by threading a catheter thin tube through a small puncture in a leg or arm to the heart. The blocked artery or arteries are opened by inflating a tiny balloon into it. This is a coronary bypass graft we're talking about, also known as a CABG, C-A-B-G, coronary artery bypass graft. Coronary bypass surgery redirects blood around a section of the blocked or partially blocked artery in your heart to improve blood flow to your heart muscle. The procedure involves taking a healthy blood vessel from your leg or arm or chest and connecting it beyond the blocked arteries in your heart. Although coronary bypass surgery doesn't cure the heart disease that caused the blockage, atherosclerosis of the coronary artery disease, it can ease symptoms, such as chest pain and shortness of breath. For some people, the procedure can improve heart function and reduce the risk of dying of heart disease. Okay, here's a list of some common cardiovascular disorders. We're going to talk a little bit about these. So CAD, coronary artery disease, AMI, which is a acute myocardial infarction, and bradycardia, tachycardia, atrial fibrillation, which is AFib, VFib is ventricular fibrillation. Then you have arrhythmias, hypertension, and congestive heart failure. Coronary artery disease is caused by plaque buildup in the wall of the artery that supplies blood to the heart, called coronary arteries. Plaque is made up of cholesterol deposits. Plaque buildup causes the inside of the arteries to narrow over time. This process is called atherosclerosis. All right, let's talk about acute myocardial infarction. It's a blockage of blood flow to the heart muscle. A heart attack which essentially is what a acute myocardial infarction is. It's a heart attack. A heart attack usually occurs when a blood clot blocks the flow of the heart. Without blood, tissue loses oxygen and dies. Symptoms include tightness of the chest or pain, neck, back, and arms, as well as fatigue, lightheadedness, abnormal heartbeat, and anxiety. Women are more likely to have atypical symptoms than men. Treatment ranges from lifestyle changes and cardiac rehabilitation to medication, stents, and bypass surgery. All right, let's talk a little bit about atrial fibrillation, known as AF or AFib. It is a irregular rapid heart rate that may cause symptoms like heart palpitations, fatigue, shortness of breath. Um, Atrial fibrillation occurs when the upper chambers of the heart, the atria, beat out of rhythm. As a result, blood is not pumped efficiently to the rest of the body, causing unusual fast heart rate, quivering, or thumping sensation in the heart. Not only can AF negatively impact your lifestyle, your quality of life, but those who have AF are 5 to 7 times more likely to form blood clots and suffer from a stroke. Fortunately, AF may be treated or can be treated with medication, cardioversion, which is a surgical procedure, or catheter ablation procedure. Atrial flutter, or AFib, a condition in which the heart's upper chambers, atria, beat too quickly. Rapid contractions of the upper chambers of the heart may spread to the lower chambers, resulting in rapid heartbeats. Symptoms may include a racing heart, palpitations, shortness of breath, and dizziness. Medication, electric shock, or procedures that destroy abnormal tissue in the heart may be used to restore a normal heartbeat, control heart rate, and prevent blood clots. Ventricular fibrillation is a rapid, life-threatening heart rhythm starting in the bottom chamber of the heart. It can be triggered by a heart attack because the heart doesn't pump adequately during ventricular fibrillation. Sustained VF can cause low blood pressure, loss of consciousness, or death. Emergency treatment includes immediate defibrillation with an automated external defibrillator, AED, automated external defibrillator, and cardiopulmonary resuscitation, CPR. Long-term therapy includes implantable defibrillation or defibrillator and medications to prevent reoccurrence. A condition in which the force of blood is against the artery walls is too high, usually hypertension. We're talking about hypertension. Usually hypertension is defined as blood pressure above 140/90 and is considered severe if the pressure is above 180/120. High blood pressure often has no symptoms. Over time, if untreated, it could cause health conditions such as heart disease and stroke. Eating a healthier diet with less salt, exercising regularly, and taking medication can help lower your blood pressure. Heart failure, a chronic condition in which the heart doesn't pump as well as it should. Heart failure can occur if a patient cannot pump systolic or fill diastolic adequately. Symptoms include shortness of breath, fatigue, swollen legs, and rapid heartbeat. Treatments can include eating less salt, limiting fluid intake, and taking prescription medication. In some cases, a defibrillator or pacemaker may be implanted. All right, let's talk about bradycardia and tachycardia. Bradycardia is slow heart rate, and it causes that aren't due to underlying diseases. Examples include family history of slow heart rate, high level of fitness, meditative breathing, sleep, or medication side effects. All right, let's talk about tachycardia. Refers to heart rate that is too fast. So bradycardia is too slow, and tachycardia means too fast. So if we break it all down, we know that brady equals slow, right? And tachy equals fast. Okay. Okay, now we're going to talk a little bit about the functions of the lymphatic system. The removal of excess fluids from the body tissues, absorption of fat acid, and subsequent transport of fat chyle to the circulatory system. Production of immune cells such as lymphocytes, monocytes, and antibodies producing cells called plasma cells. Lymphatic circulation. The lymphatic system can be thought of as a drainage system needed because of blood circulates through the body. Blood plasma leaks into tissues through the thin walls, and I thought this was really interesting, through the thin walls of the capillaries. The portion of the blood plasma that escapes is called interstitial or extracellular fluid, and it contains oxygen, glucose, amino acids, and other nutrients needed by tissue cells. Although most of this fluid seeps back into the bloodstream, a percentage of it, along with the particulate matter, is left behind. The lymphatic system removes this fluid and this material from the tissue, returning them via the lymphatic vessels to the bloodstream, and thus preventing a fluid imbalance that will result in organism death. The lymphatic system consists of lymph vessels, lymph nodes, lymph organs, tonsils, thymus gland, spleen, appendix, Peyer's patches, and the intestines. Word parts. All right, so when we look at the lymphatic system, AN equals without, immuno equals immune system, lymphano equals lymph nodes, lymphangio equals lymph vessels, lympho is lymph, flangio is ingest or engulf, spleen or spleen equals spleen, thymo equals thymus, and tonsillo is lymph node, palate, or tonsil. And when we talk about practices and specialists that treat individuals with problems or issues with the lymphatic system, we're talking about the hematologist, which is a specialist in science of study of the blood and blood-forming origins and blood diseases. The medical aspect of hematology is concerned with the treatment of blood disorders and malignancies, including types of hemophilia, leukemia, lymphoma, and sickle cell anemia. Also, you have the allergist, and this physician specializes in diagnoses and treatment of allergies. Here's a list of some common diseases or disorders of the lymphatic system: lymphangitis, lymphedema, lymphadenopathy, infections, inflammation, or cancer, HIV/AIDS, splenomegaly, lymphoma, Hodgkin's or non-Hodgkin's, and rheumatoid arthritis. So let's talk a little bit about lymphangitis. It's a medical term used for its enlargement of one or more of the lymph nodes, and it's usually due to infection. Lymph nodes are filled with white blood cells that help your body fight infections. When lymph nodes become infected, it's usually because an infection started somewhere else in the body. Rarely, lymph nodes can enlarge due to cancer. Lymphedema. It's swelling in the arms and legs. Some cancer survivors may experience lymphedema as a side effect of surgical or radiological services to treat the cancer. Early identification and treatment may prevent the condition from progressing, and this can improve the quality of the patient's life. Lymphadenopathy and adenopathy, same thing. It's a disease of the lymph nodes in which they are abnormal in size or consistency. Lymphadenopathy of an inflammatory type, the most common type, is lymphitis, producing swollen or enlarged lymph nodes. In clinical practices, the distinction between lymphadenopathy and lymphitis is rarely made, and the words are usually treated as synonymous, meaning they're interchangeable. Inflammation of the lymphatic vessels is also known as lymphitis. What is HIV? HIV, human immunodeficiency virus, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to infections or diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex, sex without a condom, or HIV medication to prevent or treat HIV, or through sharing injection during drug equipment. So they're talking about needles, syringes and needles, things of that nature. What is AIDS? AIDS is the last stage of HIV infection. It occurs when the body's immune system is badly damaged because of the virus. In the US, most people with HIV do not develop AIDS because taking HIV medication every day as prescribed stops the progression of the disease. A person with HIV is considered to have progressed to AIDS when the number of their CD4 cells falls below 200 cells per cubic meter of blood, 200 cells MM3. In someone with a healthy immune system, CD4 counts are between 500 and 1600 cells per MM3. They develop one or more opportunistic infections regardless of their CD4 count. All right, thank you for joining me, and I hope you enjoyed my presentation on medical terminology.